Today I'm so excited. First, I'll introduce myself, but I'm going to say I'm super excited to have Dr. Pier Boutin here with us, with me. I'm Thais Harris, holistic nutritionist, author, and international speaker. And today we're going to be talking about bone health and how, especially for women, nutrition, hormones, and bones connect. And so, Pierre, thank you so much for coming over. I'm so glad, we get to do this live together and not be on split screens. And I would love for you to share a little bit with everyone how you came to bone health and hormone health and women's health.
Okay. Well, thanks for inviting me. I'm happy to be here. I'm an orthopedic surgeon, and I've seen a lot of people with broken bones. And yes, we fix the bones. You have a broken hip, we will put an implant, fix your broken hip. But the underlying issue that caused the broken hip is usually not addressed. I see that over and over in my practice. And on a personal note, it applies to me. Despite the fact that I was a triathlete, a marathon runner, a fitness person, I ended up with broken bones and eventually being diagnosed with osteoporosis. Mm-hmm. And for that reason, I delved a little deeper into it and have made it a big part of my practice for my patients.
Yeah, wonderful. And so what would you say is the main issue that you see, especially for women over 40? What is happening to bone health and how to address it?
Okay, my biggest problem is convincing people that they have to address their bones. Unless it hurts, people ignore it. And osteopenia, so that's low bone mass, but not quite osteoporosis, and osteoporosis do not cause pain. So right. People, they ignore it. And it is really important to address it at a young age. People who have better bones live longer and a better life. And it's not something that you should wait till you're 70 years old and have a broken hip. Start thinking about it in your 30s and your 40s and your 50s. And I want to reach out to those people, and I have a hard time.
Yes. And yes, and also the fact that bones are very much a live part of the body, right? It's always building. You're either building or you're destroying. And so how can you keep that building momentum, especially when you're a little bit younger?
Okay, so you've made a really good point that people don't think about. Bone is not static. So we're always building bone and taking away bone. So your forearm bone here, your ulna or your radius, it wasn't there 7 years ago. This is all new bone cells.
Right,
it's hard to think about it that way.
Yes.
So you can always address bone issues. It's not something you say, oh, it's too late. No, this is always happening. Even after menopause, this process is still happening. So it can be addressed at any time, but it's better to address it when you're young. So we keep building bone, more and more bone, until we're in our late 20s and 30s. Mm-hmm. After that, we're kind of static until we're hitting perimenopause, menopause, and then we start losing bone again. Mm-hmm. Don't wait till you start losing bone. You want to build the best bone mass you can in your 20s and in your 30s before you start that downward slope. And that's why we make such a good couple here, is because the number one thing that you can do for your bones is your nutrition.
Right.
What you eat makes a huge difference.
And so how can you set up that terrain so that you can keep, even when you go into the phases where you're kind of static or even starting to have more bone loss, that you can still keep some of the building going? Like, what are things that people can do nutritionally that can help?
Okay. Well, it's really, throughout your whole life, you should be doing this. Certain things you absolutely have to avoid. There are 5 major things you have to avoid. One of them is sodas. The other one is sweets. And when I say sweets, I don't mean just sugar. I mean breads and white carbs, because those break down into sugar. Yes. People don't think about that. But cereal is not a healthy breakfast.
Right.
And things like don't ever smoke. You will have osteoporosis. Alcohol is also bad. And salt is not. Oh, I forgot about salt. Salt is not great for bones either. The only way that our bodies can get rid of salt or excess salt is to make a deal with calcium. So calcium and salt have an exchange in the kidneys in order to go through the kidneys, and the only place we store calcium is in bone. So people that eat a high salt diet, which is a typical American diet, lose bone much faster. And I can tell that by doing a 24-hour urine calcium.
Okay.
If you want to know if you're eating too much salt, do a 24-hour urine calcium.
Because there may be a healthy amount for each of us that might differ a little bit, but it's when we go into that excess that we're encountering the issues, right?
Right.
And what would you say are some of the things that we definitely want to focus on adding more of? Because sometimes it's hard if we just focus on what to let go, but if we know, like, okay, we can have some balance with these things that are really going to suck the bones out of us, and then we add these things that can help support it.
And you're right. I really don't like it when people, and I have to avoid doing that, when we tell people what not to do instead of telling them what they can do. So thanks for saying that.
Sure.
Appreciate it. So as we get older, we don't eat enough protein. Especially by the time we get into perimenopause, menopause, that's the number one thing is more protein.
Yes.
And that's really important for bones. And the other thing is you want to try to get as much as your nutrients through food, not so much through supplements. Yes, I agree with supplements. We all need supplements, but it's important to try to get it through food. So you need your leafy greens and your fish and all the nuts and all the good foods. So.
Yeah, there's all the cofactors too, which I think sometimes, yes, we can bridge certain gaps through supplements, but that in whole foods, everything comes packaged in a way that allows us to absorb better. There are cofactors to help us enhance the action of certain nutrients. So, yes.
And actually, along those same lines, the same thing that happens is when you eat those healthy foods, you end up with a healthy gut bacteria or good microbiome. The microbiome is actually the whole entity of bacteria that live in your gut. And there's about 3 to 4 pounds of bacteria in your gut. And you can have good bacteria and bad bacteria. And if you eat good food, you get good bacteria that helps with the absorption of good nutrients. So and supplements can't do that, but good food can.
Right, exactly. That's wonderful. And have you seen any, I'm just curious as far as like research on microbiome and bones specifically, has there been any direct?
Absolutely. So when I say that food is the most important thing for osteoporosis or for bone health, is not only because you get the nutrients, but people who have an unhealthy gut have a direct link to bone loss and osteoporosis. For example, people with gluten sensitivities or celiac, 100% of them will develop accelerated bone loss. And a great majority of them end up with osteoporosis unless they go on a very strict, no gluten diet.
Right.
People with ulcerative colitis, Crohn's disease, all end up with osteoporosis. And both those conditions are an abnormal microbiome, where the bacteria they don't have enough of certain bacteria, or they have too many of the bad bacteria.
Right. And all the inflammatory processes that go with it, and that inflammation ends up causing the bones to leach their active.
So many levels. The inflammation and the lack of absorption of nutrients. And actually the bacteria break down food so that we can absorb it. A good example of the importance of those bacteria, there's a certain bacteria in your gut that literally activates the vitamin K2, into vitamin K into K2. So vitamin K, you can get it through foods. It's common. However, many people as they get older no longer have the bacteria in their gut to activate K2. So that's why when we say you should take a supplement K2, you have a vitamin K, we say take the vitamin K2 in case you don't have those bacteria.
Right.
So the role of, essentially the microbiome should be considered an organ. Like, how you have the heart or you have the kidneys and the bones. Another organ, even though it's a little separate, should be the microbiome. because that affects our entire health, our entire life.
Everything. Mood, like you talk about mental health, everything, right? Yeah.
Absolutely.
So how about vitamin D, since you brought up vitamin K too, and maybe we'll get into hormones a little bit, because hormone balance has a direct relationship with our bone health as well.
So you want me to talk about vitamin D?
Yeah.
Okay. Well, they're actually thinking of changing the title of vitamin D to a pro-hormone. It is that vital to so many organs in the body. There are receptors for vitamin D on just about every organ. It is that important. So vitamin D not only helps with the resorption of calcium, it helps you save calcium. It helps with inflammation and so many other activities in your body.
Right.
Matter of fact, 100% of people in heart failure have low vitamin D.
Right.
I mean, it is
depression is another
depression
one,
is
right?
another one. Sometimes I have patients come into my office and you know those kids that spend a lot of time on the computer and don't go out in the sun very much. They're 15 to 30 years old. They walk around with their hood over their head, and I start them on vitamin D, and within 3 weeks I see a difference. I see improvement.
That's amazing.
The thing about vitamin D, though, the range that's acceptable. So the normal range is from 30 to 100 when you get your serum tested at the hospital or in the lab. But 31 is not acceptable. 35 is not acceptable. Your range should be closer to 60. Anything between 50 and 70 is great. If you're 80, it's still great. It's incredibly hard to overdose on vitamin D. And the side effect is your calcium goes up a little bit. I mean, there's only been like 1 or 2 reported cases of overdosing on vitamin D. So don't be afraid of vitamin D. And have it tested. Make sure your range is in the right place.
Right.
Because I see so many patients that come in and say, oh, my vitamin D is fine. It's not. I look at their chart and the vitamin D is 32, 33. Right. And it's not. And one of the things that I find when I look for secondary causes of osteoporosis, so any patient that comes to my office, I don't just treat them for osteoporosis. I look if there's any reason that can be addressed as to why they have ongoing bone loss or why they've lost so much bone. One of the most common things that I see is a chronically low vitamin D.
Oh, yes. So super important, right? And also, even with supplementation sometimes, because people have read about vitamin D and so they might go and get their own supplement and it's like 1,000 IUs and maybe they're doing it once a week or not being very consistent with it, that's not going to do much. So depending on your level, once you get your labs done, you may need to go to 5,000, 10,000, and also the frequency of it, especially here in the Northern Hemisphere. So Pierre and I are in the Berkshires in Massachusetts. And this time of year, even going outside, we're not going to be able to synthesize a lot of vitamin D because we're not getting all the rays that we need to get.
Oh,
so,
wait a minute.
Go ahead.
So in order to get enough vitamin D from the sun, you and I would have to lie in the sun 8 hours a day naked. So,
Yes.
So
fun as that would be.
So the point is, don't stop taking your vitamin D through the summer. You still need it. People who have the lowest amount of vitamin D actually live in Florida. And as you get older, we don't absorb through the skin as well. Mm-hmm. When you're younger, you do pretty well, but as we get older, we don't.
Also, if we're outside and we're covered in
sunblock,
then we're not going to do it. No. There's many other sort of theories nowadays about different chemicals and things that are in our food that also interfere with our ability to synthesize it. So there's a lot going against it. So check your vitamin D and get, and talk to somebody, talk to a doctor, a nutritionist, so that you can figure out what's the proper dosage and how often.
And it really varies from one person to another. This is not a standard thing. People who have GI issues, like we talked before about celiac, Crohn's disease, or just IBD, IBS, they actually need more vitamin D than other people.
Right.
Sometimes I can't get their levels to where it needs to be without taking 10,000 a day for a long time. By the way, once your vitamin D level gets to where it needs to be, you have to stay on it. You can't stay on that dosage. You can't stop. It'll drop within a couple weeks.
Right.
So Okay,
So
we've
important.
squeezed out vitamin D.
And yes, and vitamin D and K2, they have a special dance too, because K is also signaling where the calcium should go, right? So that we're not getting calcium in weird places where it shouldn't be, and instead it's going to bone. So having a vitamin D that has that K2 added can be really
That's essential.
helpful. It's essential.
I think it's almost as important as your vitamin D.
Yes. Okay. Yes, because they work in tandem, right? Like many things, as we were talking about before, even so when you're eating your wild fish, for example, and you're getting a lot of those cofactors together in the food.
Mm-hmm.
But you would have to eat a lot of fish to get all your vitamin D up when it's low. So yes, back to the supplements.
And wild fish.
Yes, and lots of that. So how about hormones then? And so since we started vitamin D and now being considered a pro-hormone, what do hormones have to do? And especially for women, and talking about estrogen and other hormones, how do they interact with bone?
Okay, so both estrogen and testosterone are key hormones to build bones. And yes, women have testosterone, and yes, we need it. And it doesn't cause hair on your lip or you to go bald.
If anything, it helps have a little more go juice.
Yes,
things, right?
it does.
Yes.
So we have plenty of hormones when we're in our 20s and our 30s. Somehow in our 40s, it starts to wane a little bit. Estrogen comes down. And by the time we go through menopause, obviously your estrogen goes down. And that's when you see the greatest amount of bone loss. Now, there are a lot of women out there that have had abnormal menstrual cycles, have had horrible cramps, horrible bleeding, or have difficulty getting pregnant. They'll have abnormal hormone levels, maybe in their 20s and 30s, and that is actually affecting their ability to make bone. And those women have to think about that early, not later.
Right. So anything that's going sort of sideways with periods, right?
Yes.
And if we're having a lot of difficulty, whether it's a lot of bleeding, a lot of pain, discomfort, PMS, all of those
Irregular
things
cycle.
It's a good thing to look at, and I think it's normal. You know, as a teenager, I had crazy periods, and I thought, well, my mom had them, my sister had them, it's normal. Guess what? It's not normal. It may be common, but it doesn't mean it's normal, and it definitely doesn't mean it's optimal for your health and for longevity, which bones are a big part of, right? Because the whole part of this conversation is that, yes, bones matter because we want to live well, and we want to be able to do all the things we love doing well into our later years, right? So
yeah, and I mean, it has been shown statistically. I mean, if you break your hip after menopause, 50% of people die after that within a year.
wow, 50%.
Yeah, well, men, actually more men than women. Women it can survive a hip better than a man.
Wow. Yeah, that's a big number. So,
and not only that, even if you survive, you never walk normally, you're not able to exercise like you want to. It's not like you 100% recover. Sometimes you do, but often you don't, especially if you're already in your 70s when you break your hip.
Yeah. And also thinking about the state of healthcare and support for the elderly. It's like once you break your hip, if you don't have a whole support group around you, it just, life becomes
so hard.
So hard. Right?
So hard. So we're talking about broken bones. Not all broken bones are osteoporotic fractures. And osteoporotic fractures don't only happen after menopause. They can happen in your 30s and 40s. And a typical osteoporotic fracture happens in the flare of the bones. So in your humerus, in your wrist. A wrist fracture is typical of osteoporosis. And there's a certain way that it breaks. It doesn't break in a clean 2 pieces. It breaks in 2-3 pieces or more. It doesn't have to be very angular. I can see it on x-rays. I mean, there's a certain type of fracture on the wrist. But also the hip and the proximal tibia, those are all typical osteoporotic fractures. Ankle fractures, toe fractures, finger fractures, those are not typical osteoporotic fractures. So you can break your toe 10 times. It's probably not related to osteoporosis.
But don't break your toe 10 times.
Right, but you stop running into corners. But long bone fractures, like both bone or your tibia, those are usually not associated with osteoporosis. But your doctor can pretty much tell which fracture, or should be able to tell which fracture is associated with osteoporosis or low bone mass.
So that then if somebody is especially younger than 40, let's say, if there is such a fracture, you would then be able to test your bone health and start
that's
doing
how I
something
figured
right
it out.
away, right?
I had a bike wreck. I was racing and I fell, and I broke my hand, but I didn't just break it in 2 clean pieces. I had like 20 pieces. I had to fix it. They put a whole bunch of pins, and I had a porcupine hand to try to fix it. And it's not normal in my late 30s to have that kind of break. I should have just had a clean break, and I didn't. And something rang in my head, and I said, I need a bone density test. And yes, I had osteopenia in my late 30s.
Wow. Yeah. And so that's good that you found out, but that break.
But I needed to address it then. And at those days, we weren't really talking about it. And we didn't really know so much about all the nutrition and the GI issues and all those things that we do now. So
yeah. So now when we talk about, like, circling back to hormones and especially estrogen and testosterone, a lot of the diet that you talked about supports those hormones as well. So there's a whole way in which, when we're talking about focusing on nutrition and adding more protein, and that can actually be great for vegetarians and vegans too. You have to be a lot more committed to your protein intake and very, very mindful to not have a lot of carbs instead, when you're not consuming those animal proteins, but it can be done.
it's hard though. To be a vegan and get enough protein is hard work, and you have to be very knowledgeable. And some of my patients they're great, but some of my patients, they're not doing it right.
I know.
I wouldn't let my teenage daughter be a vegan, which is sad, or maybe in the 20-year-old, because they don't know enough yet about how to, well, most of them, some of them do.
Sure.
But it's a really hard thing to do. Yes. And if you're busy going to school and doing all these other things, you're going to get that macaroni and cheese or macaroni and vegan cheese, whatever. That's not healthy.
Right. And it's not going to support the bone health, the growth, the hormone support, all of these things, right, for the long term. So, but doing in this way that you're looking at whole foods, that you're looking at your protein intake, that you're limiting your sugars, that you're staying hydrated and limiting all the sweet drinks, especially sodas. Sodas are like number one for bone reduction. And so when you do those things, not only are you helping your bone, you're helping your hormones, you're helping your microbiome, which then helps your mental health, which then helps your skin, because microbiome, it's
absolutely
all connected, right? And so are there any other tips that you would say as far as the hormone piece, and now focusing on women that are perimenopausal or menopausal? So how to...
So I actually use hormones in the treatment of osteoporosis, well, osteopenia, early osteoporosis. So in my patients who are perimenopause and early menopause, who have, early onset osteoporosis or advanced osteopenia and have menopausal symptoms, hormones do help. Hormones do two things actually. They increase bone formation and they lower bone loss, but at a slow rate. So you still have to be in the early stages, because if you're in the advanced stages, your risk of a broken bone, the hormone's not going to work fast enough. Okay. But if you're in the early stages and you have menopausal symptoms, if you're having night sweats, you're not sleeping, your mood, you overreact to situations, sex is not fun, sex is painful, then you can address those symptoms and the low bone mass at the same time. It's a bit of a miracle treatment for a lot of women. And that has to be addressed, and it's too often ignored by the gynecologist.
So bioidentical hormone
and
replacement.
I didn't start off doing bioidentical hormones, but I realized there was a huge place for that in my treatment of women and of bone health. I couldn't ignore it. It's too important. I have women that are on hormones that into their 80s, because not only does it help your bones, but women on bioidentical hormones have a lower rate of GI cancer, of heart disease, Alzheimer's. So there's a lot of benefits to bioidentical hormones done right for the right patient.
Right. And there was a study that was a little scary because people thought, oh, bioidentical hormones may increase your risk for breast cancer. But I think since that study has been
Okay, so that's the
and,
NIH study. I mean, the Women's Health Initiative's WHI study that came out. So then we studied and followed the nurses from World War II. And that was a really large group of women that was studied for an extended amount of years. And about 15 years ago, they looked at their data and noticed that there was a slight increase in women who were on hormones for menopausal symptoms, slight increase of breast cancer in the women who had pre-existing risk factors. Their mothers had breast cancer or they had genetic factors associated with it.
And those weren't even bioidentical. Right?
Those were not bioidentical
That's
hormones.
Big difference.
Big difference. The hormone we used to give to women was actually a copy of the estrogen that horses found in horses' urine. I mean, it's so totally not close to any of the estrogen that we produce. But in that same study, they went back and looked at it 10 years later, and they said, oops, we forgot to mention all the benefits for those same women that were on the hormones. So that study's kind of gone out the window for several reasons.
But thank you. It's so important to say it because I hear people quote that still. You know, there's certain things that really stick after the fact. And so I think it's important to mention that.
The worst thing we did for menopausal women about 20 years ago when that study came out, from one day to the next, the doctors, all of us took, well, not me, but we all did because I wasn't doing that. I was operating. But we took all women off hormones. And you can't just take women off hormones like that when so many of those women actually needed it for more reasons than just their bones. It wasn't fair. It was such a disservice that we did to women and not thoughtful.
So it's taking a long time to undo
come around
some of the yes. Well, so what would you say as far as like if we could narrow it down? Of course, it's never just the one thing, the one miracle thing you can do. But if we had 3 top strategies so that if people listening, they thought, well, in 2024, I'm going to focus on my bone health and hormone health. What are 3 things that you feel like would be really important to focus on? Some of them you might have already mentioned, so it might be a little bit of a reminder, but...
So one is don't ignore it. And if you have any risk factors, family history, you've broken a bone and you're not sure, you have been on long-term anticonvulsant medications or long-term antacids or even antidepressants, they put you at higher risk for bone loss. Make sure to get your bone density at 50 or even younger. So don't ignore that. 1, 2, eat well so that you can have a healthy microbiome. That's the number 1 thing. Number 2 is take the supplements that you do need. And the supplements that I, excuse me, there are 4 supplements that I recommend. There are the building blocks for bones. And that's calcium, vitamin D, vitamin K, and magnesium. Now, there are a lot of other supplements that are important. I mean, strontium, boron, collagen, probiotics. The list goes on. And I encourage people to take a combination bone health that might have a lot of those. But the 4 basic ones are the D, K, magnesium, and calcium. Those are mandatory. And then I want to touch on exercise. So exercise is great. But as you heard, I'm a triathlete. I am a marathon runner, and I still ended up with low bone mass. Exercise alone does not rebuild bones after menopause or even in perimenopause. Exercise when you're in your teens and when you're building bones in your 20s is incredibly important to build that good bone mass. But if you're trying to reverse osteopenia or osteoporosis with exercise alone, you will fail. There was a study that came out saying that yoga can reverse your osteoporosis. No. So in that study, what happened is they were looking at in the spine. They noticed after doing a couple years of yoga that there was some improvement in the T-score, which is a way of measuring the bone mass in your back. There was some improvement. Mm-hmm. But what happens when we get older, the T-score for the spine is no longer reliable. Once you get arthritis in your back, it gives you a false negative bone density test of the spine. Once you have arthritis in your back, you have to rely more on the bone density test of your wrist and your hip.
Okay.
Because when you get osteoarthritis, you get these little bone spurs around the vertebrae, and that makes it look like the bone is denser when we do the study than it actually is.
Interesting.
And so you have to really study the raw data. That's another thing. Okay, I'm just going to touch up. So you get your bone density test, and they give you a number, your T-score, your average hip score, and your average spine score. Well, you don't break where the average score is. You break where the weak point is. Mm-hmm. And when we test your hip, we test like 20 different spots on your hip, and we test 5 different spots on your back. So, for example, if your T-score on your spine, your L1 level, there are 5 lumbar vertebrae, mm-hmm. and your L1 level is minus 2.5, but your L5 level is minus 1.5, let's say, which is osteopenia, but except your L1 is osteoporosis. But if you average out all the levels, you end up with a minus 2, which is not really osteoporosis. Well, your L1 is still at really high risk of breaking. And so you have to look at the raw data.
Consider everything. You consider all the
but the reports don't give you the raw data. They give you an average.
Okay.
Which the average is good when you want to see how you're responding to treatment, but it's not great for assessing if you need treatment. Mm-hmm. So
that's interesting. I want to circle back to the yoga and exercise, though, because I feel like 2 things. And I know you're not saying that yoga is not helpful.
No,
it's
that's
very
right.
helpful. It's just that it's not alone. So you have to combine it with the food and the supplements, the stress reduction, which is another piece that is so huge because stress creates chemicals that then create inflammation, that so on and so forth.
And on the yoga, it actually reduces the rate of hip fractures, but not because it rebuilt the bones, but because people are strong and have better balance and don't fall.
Exactly.
So it is still important, but it can't be the only thing you use to reverse your osteoporosis. Right. And I'm glad you brought that up, make that point clearer.
Thank you. No, that's great. And I feel like one thing that people often overlook, and like you said, you were, running marathons and being very physically active and doing a lot of cardio, which is great. But also strength training and weightlifting is so important, especially after 50.
And walking is not enough.
Right.
People think that walking is a fitness thing. It's good for your heart, but it doesn't really rebuild your bones. You have to do strength training, the weightlifting, the lunges, the squats, the getting up and down from the chair. Mm-hmm. Just those are all important.
And sometimes, depending on the yoga, that can help too, because a lot of yoga, you are holding yourself up, you are doing all the calisthenic exercises, right? So
and
that can be important.
All that,
and poses that can be about structure of bones, which the kind of yoga that I have practiced for a long time is called shadow yoga. And it's really aligning bones. That a lot of it is about how you put your weight on your body.
I just want to say it's really great for somebody your age, but by the time you get to be my age and older, some of those yoga poses are really hard.
Yes, they can be very hard. They're already hard for me, trust me. But I feel like doing things where you're not in pain, that's really important. I think we can push ourselves in exercise to a point where it's like, I feel like when I'm lifting weights, I get to the point where it's like, I cannot lift again. That's great stress. It's stress, and it's a challenging stress. But if something is hurting, then we stop because we don't want to create more issues. Same thing with yoga or any exercise. So that's wonderful. So don't ignore it. Microbiome, pay attention to the diet, exercise, and those supplements. That's wonderful. So Pierre, what are some of your favorite ways today, like in your current lifestyle, that you find like maybe some favorite foods or favorite ways to exercise that keep you active and building bone?
Well, actually, everything we've talked about, I pretty much live that way. But I have to tell you, I mean, I gotta be honest here. Yeah, I don't drink alcohol. I don't drink coffee. All those kinds of things. But the diet is hard. And I try not to eat sweets, but I'm probably good 85% of the time. And I try not to be too hard on myself. And Christmas was around, and I did eat lots of chocolate. But I just start again the next day. I don't bash myself over it. And you still have to enjoy the little things in life without harm. And so to be 100%, it's almost too hard. Some people can do it, but I mean, I'm not one of those people. I believe in everything in moderation.
Yeah.
There's certain things I won't accept. I won't drink a soda, and I won't, drink alcohol or those kinds of things, or I won't smoke a cigarette. But
right. For certain things, the line is very clear. Yeah. For others, it's a little more 80-20 or 85.
Right.
That's
I mean, I don't want to be too judgmental. I mean, I want people to have fun, but just be conscious. If I go to the restaurant, I'll tell them, don't bring the bread, because I don't have that much willpower. And if there's bread at that table, I'm going to want to eat it. Right. And it takes an incredible amount of willpower to not have it if it's in front of me. But I'll tell them, just bring some vegetables or some snacks, some carrots or something like that at the table while you're waiting for your food. That's an easy thing to do.
Definitely. Yes. And I'd love to introduce everybody listening to Pierre's book.
Oh.
Even though it's a very different subject. Well, not that different, because it actually explains a lot of your story and history. But it's called The Little Mo Effect. And I should have brought my copy down here. I didn't. Okay. Oh. But we'll post about it. But tell us a little bit about The Little Mo Effect and how it came to be, please, so that people can go, and it's on Amazon, it's on
bookstores,
and yeah.
The Little Mo Effect is my journey over a 10-year period of time, and it's from starting from a pretty dark or hard place in my life, and how meeting this little boy in the Atlas Mountains turned things around for me. Okay, so I'm going to go into more details. Do I have a minute?
Yes. Yeah, okay. Of course.
So quickly, I brought a team to Haiti after the earthquake of 2010, and we were the very first team 2 days after the earthquake. We had over 100,000 patients with orthopedic injuries. We operated every day, 16 hours a day, taking care of patients with a headlamp, you name it, try to address the orthopedic issues. And since I speak French, I was ended up being the leader of this makeshift operating room. And there was a lot of hard decisions to be made. And it was really raw conditions to operate in. We certainly didn't have a sterile operating room. We didn't have enough alcohol. We literally had to clean our instruments with bottles of high intense vodka. I mean, it got to that point. Yeah. And when I came back, I started ruminating over every decision I made and everything I saw. It was hard. I mean, there's a lot of bodies and there's a lot of trauma. And so my girlfriends convinced me to take a trip to totally change my mind and to do something fun that would distract me. So we all go to the Atlas Mountains of Morocco. And there we hike days on up the mountain, and I find this little boy with deformed feet who can't walk. So like a normal person, I decide that I have to fix those feet.
Like a normal person. I live a little beyond a normal person. But okay.
So, but I tried to get help for him over there because he was already 3-4 years old and he couldn't walk. He kept trying, he tried to stand up, he kept falling. And I couldn't get any help. So eventually I brought him to the United States to live with me for almost a year while we corrected, had his feet corrected. I don't do foot surgery. It was actually done at Shriners Hospital. They were wonderful. And doing that, helping someone else, doing something for someone else totally took the focus away from the dark space I had inside of me and gave me purpose and completely changed my life. And the book kind of meanders through that path. And the effect of Little Mo is still going on now and has affected so many people in many lives. Matter of fact, it comes all the way back around. There was an earthquake in the Atlas Mountain, exactly where that little boy is from. His entire village was affected. There were 290 houses or homes in that village. Every single home was damaged or uninhabitable. So within a week, 4 to 5 days after that earthquake, I went with that little boy's sister, actually, but you'll have to read the book to know the details. But we saw over 200 patients, treated them medically. We brought 400 pounds of medical supplies to the Atlas Mountains to take care of those patients.
It's so beautiful. Like the whole story and the magic, all the different people that came together to help little Mo and to support you and supporting him. The stories about his family and about being in Morocco and everything that was going in your own life personally. And you still were able to step outside of your own space to like care for somebody else. It's pretty amazing. It's one of the most inspiring stories. And Pierre is such a beautiful writer. Oh. So it was such a pleasure to read that book and like just soak into that world and see how much positive, karma and beauty was brought in because of this experience and the little Mo effect.
That little boy is magic. He's now 16 years old.
Yes.
And
playing soccer.
Yeah, playing soccer.
Amazing.
Yeah.
Thank you so much, Pierre. I'm so glad that we could do this together.